colleague from California, Mr. Lungren.
I thank the gentlelady for yielding. Mr. Speaker, I rise in support of the resolution establishing Women's History Month. I do this on behalf of my 92-year-old mother, my 4 sisters, my 2 daughters, my 3 granddaughters, and in memory of my grandmother, who graduated from a small Nebraska college in 1898. And I also do this in honor of some great women in my life, the Catholic nuns who taught me, who taught my brothers and sisters, who taught my children, and who this day are doing unlimited number of acts of mercy around this country. And on their behalf, I would like to clarify the record, because the Speaker has said today that the communities, religious communities of nuns across the country support the health care bill as a life-affirming bill, and therefore do not agree with the Catholic Bishops' Conference that, in fact, it fails the test of protecting life in the consensus that has been established on this floor for the last 30-plus years. A statement from Sister Mary Ann Walsh, Director of Media Relations, the United States Conference of Catholic Bishops. A recent letter from Network, she says, a social justice lobby of sisters, grossly overstated whom they represent in a letter to Congress that was also released to media. Network's letter about health care reform was signed by a few dozen people, and despite what Network said, they do not come anywhere near representing 59,000 American sisters. This letter had 55 signatories, some individuals, some groups of 3 to 5 persons, 1 endorser signed twice. There are 793 religious communities in the United States. The math is clear, says Sister Mary Ann Walsh. Network is far off the mark. On behalf of those great nuns that I've had the privilege of being influenced by during my lifetime, and those that have done considerable amounts of mercy in communities that I represent, the record ought to be straight. My wife and I had the privilege of knowing the Carmelite nuns in Georgetown, California, and we have had the privilege on an almost annual basis to visit with them. They are more than just a handful of individuals, and they and others like them stand for life unequivocally. They understand the protection of life. They understand that for the last 30-some years, we have had a consensus on this floor, in the Senate, and in legislation passed by a number of presidents, and that is federal funding of abortion is to be limited. The language in the Senate bill changes the law. Let the record be correct.
Gentleman yields. Gentlewoman from North Carolina Reserve.